My name is Kjell Hansen. I'm the chair of the European Lung Foundation, and it is my absolute pleasure to welcome you to the third Bronchiectasis patient conference. A very warm welcome to you all. We are now about to start the webinar. And before I have the great pleasure of introducing the host, the co-host of today, I will just take you through a few of the housekeeping issues for how this event is going to work. So we are running this as a webinar. So attendees can only see the speakers and chairs and hosts. We cannot see other participants. Everyone will be on mute, so we can't hear you, but you can participate in the chat and through the Q&A. And we really appreciate you doing so. So in general, you can say that if you have a few comments, then let us know in the chat. If you have questions for the experts, either healthcare professionals or patient experts, then let us know in the Q&A, and you will find both functions in the taskbar at the bottom of the screen. In the Q&A, do write your questions in the Q&A board, and we will try to answer as many as possible that we have time for. And those not answers, we will try to get answers from the speakers after the event and put these on our website so you can access them after the event. There are expert clinicians answering your questions, so you can believe in the answers that you get. Please keep in mind that we cannot answer questions about anyone's personal circumstances or cases, so we'll answer the questions in a generalized form. There will be a couple of polls during the events, so we will be asking you to participate in those throughout the day, so do take part in those if you can. And if you're on social media, then feel free to tweet using the hashtag Bronchiectasis 2023. Do tag ELF, EMBARC, the research network, and the European Respiratory Society as well, using the Twitter handles that are also shown on the page. The event will be recorded and talks will be made available on the ELF website and the ES Respiratory channel after the event, so you and others can freely access them. And we'll send out the links in an email to attendees. It usually takes about 2 weeks to get the recordings on the website. And then I'm also very excited to address the latest question in the chat box. So we are using a Wordly translation app in this event. And that means there'll be automated translation in 26 languages. We have posted the links to the Wordly app in the chat box, or you can scan the code on the screen. When you access the app, you should select first of all the language that you want from a drop-down menu, and then click Attend. So Wordly will open in the screen, and you can position it along the webinar or view both screens. So you can read the transcript on your device or use a headset to listen to the audio. Automated translations are not perfect, so some words will be muddled or a little bit off, but we hope it works well. We have at least experienced that it has been working well and that the service is improving. If you do have any problems accessing the app, please email us at info@europeanlung.org, and a member of the ELF team will help you out. And of course, we will also have subtitles on the recordings. So now it is my absolute pleasure to welcome the two co-hosts of the event. We have Maria Soares from the ELF Bronchiectasis Patient Advisory Group. She is from Portugal. And we have Dr. Mikhail Zhdanov, who is head of the Bronchiectasis and Adult Cystic Fibrosis Service at the Carmel Medical Center in Haifa, Israel. So welcome to you both, and thank you for joining the event. So we are absolutely delighted to hear from you now for the third year in a row And please, Maria, go ahead.
Thank you very much. Thank you for the kind introduction. My name is Maria. I live in Lisbon. I'm from Portugal. And I have joined the Bronchiectasis Patient Advisory Group in 2020. And it's been a privilege to meet everyone and to interact with everyone at the PAG. I was diagnosed around 10 years ago. I'm a mother of 3, a scientist and a keen sailor, trying also to navigate the often very stormy waters of bronchiectasis. We hope that today's conference will provide some tools for patients, for carers, and also for healthcare providers. Last year's conference was a success, and we have used the feedback from attendees to help us shape and improve today's program. So, as requested by your feedback, we will have more on airway clearance techniques, on bronchiectasis during the various stages of life, and of course, the all-important scientific advances. We hope some of the experiences and tips shared will give insights to different ways of managing bronchiectasis. With this, I'll hand over to my co-host, Michal, to introduce herself.
Hello, thank you, Maria, and good morning, everyone. My name is Mikhail Zhdanov. I'm a pulmonologist from Israel and a member of EMBARC, the European Bronchiectasis Collaboration of clinicians and researchers. This patient conference is in its 3rd year, and we're delighted once again to have an involvement of both clinicians and patients. This engagement is a great opportunity not only for patients and care to learn more about the disease, but also for us clinicians to understand the gaps and needs in care and in knowledge of bronchiectasis. This is why the conference is open to everybody who wants to learn more, patients and families, experts and non-experts, healthcare workers of all disciplines. This year, along with the basics of bronchiectasis and new therapy, the conference will focus on 2 new topics. The first is the different ways of managing airway secretions through airway clearance, so-called chest physiotherapy. In this session, expert physiotherapists and patients will demonstrate the different techniques and will discuss tailoring of techniques to the patient needs. The second session highlights the different needs of bronchiectasis in various stages in life: childhood, teenage years, adulthood, focusing on reproduction and older age. I'm very excited to hear many new experts and patients speaking this year. The conference is organized as a collaboration between the European Lung Foundation and EMBARC, and we thank the members of the ELF Bronchiectasis Patient Advisory Group, co-organizers of this event who help plan the content and make sure that the content will be important and relevant to people with bronchiectasis and their family members. Our audience today is made up mostly of people with bronchiectasis and family members, but we also welcome healthcare professionals, medical students, patient organization representative, and members of the public who has joined us to find more about bronchiectasis. We are very excited to have more than 1,750 registrations to be precise, and people coming from 90 countries. About half are people with bronchiectasis and care family members, and about half are healthcare professional or medical students, and some are patient organization representatives, and you're all very, very welcome. So remember to put your questions in the Q&A box, and remember we can't answer questions about anyone's personal circumstances or care. So please like any questions in the Q&A that you feel are relevant to you. This will flag them so we can attend and answer. We'd like to have a poll now, and just as a small exercise to the polls that we'll have during the different talks. And as one of our sessions today is about the different life stages of bronchiectasis, we want to find out what age groups are people with bronchiectasis that are with us today. So if you have bronchiectasis yourself, or you're caring about a patient with bronchiectasis, please select the age group that you are in. So I think the polling is now open, so please select the choice that is appropriate to you. Okay, we'll give a few more seconds to vote. Okay, so I would see this is a really nice distribution of what we see in bronchiectasis generally. So the majority are between 40 and 70, some younger and some older, which is a good distribution of what we usually see in bronchiectasis. So thank you everyone for voting. So with that, I'll hand over back to Maria to introduce the first session, and have a lovely conference, everyone.
So now, before going into the introduction of the next session, I will just like to give you a brief outline of the sessions for the day overall. So you can also access this program on the ELF European Lung Foundation website, and we will put the link into the chat. There are 4 main sessions, and each has 2 co-chairs, a patient like myself and a clinician. They will introduce the speakers, keep track of time, and coordinate questions at the end of each session. There is time allocated for questions after each session in the end. The first session will give an introductory overview of bronchiectasis, as it's important for us to understand what it is and how it can affect us. Session 2 focuses on airway clearance, and we will hear from people with bronchiectasis about their daily clearance routines, as well as some videos demonstrating airway clearance techniques. There will also be a panel discussion between patients and physiotherapists who work with people with bronchiectasis. We will then have a short break of 10 minutes before coming back to session 3, when we have 2 talks, one on the latest on bronchiectasis research, and a talk on advances in digital healthcare and how it might help people with bronchiectasis. After this session, we will have a longer break of 45 minutes and come back for our final session, which explores bronchiectasis through life stages, like Michal referenced. So we start with children and adolescents, adulthood, and then talk about bronchiectasis during pregnancy, fertility, and finally bronchiectasis in older age. There will be another 10-minute break during this session. So with this overview, we can now move to our first session, and it gives me great pleasure to introduce our first talk, which gives an overview of bronchiectasis by Dr. Katarina Dimaku from Greece. Katarina Dimaku is a chest physician and director of the respiratory department and director of bronchiectasis outpatient clinic at Sotira, Chest Diseases Hospital of Athens. Katarina is a member of EMBARC, which is the European Bronchiectasis Network Steering Committee, and she has received many distinctions and awards from the Hellenic Thoracic Society on the topic of airway diseases, such as bronchiectasis, COPD, and asthma. Dr. Katarina Dimaku, thank you very much to be here today, and the floor is yours.
Thank you very much, Maria, for this introduction. Thank you, Michal. Thank you for the invitation to participate in this very important seminar for third time. And I'd like to congratulate you and all the organizers of ELF for this initiative. So I'll start the conference with an introduction to bronchiectasis. And we shall discuss in brief what is bronchiectasis, how common it is, which are the causes, the symptoms, how the diagnosis is confirmed, what about exacerbations of bronchiectasis, and the general directions of treatment. You all know that.
Katarina, can I just ask you, could you put it in presentation mode if you can?
Excuse me. Now is okay? Is it okay now?
No, I think if you go to slideshow, and there should be a way to put it in presentation mode.
I have opened. Sorry. New share. Can I press new share?
No, you're sharing, but you need to start your slideshow so that it goes into presentation mode. So Sabrina says if you click the bottom right icon, or F5, try clicking the F5 button on the top of your keyboard.
For me, shows that it is opened.
Your presentation's open, but it needs to be in like a full screen presentation mode. So
I have put it here, but I don't know why you.
don't worry, if you can't do it, just do it as it is. That should be okay.
Are you sure? Because I can't do nothing more. For me, it's opened. I don't know. Do you want me to start from the beginning?
No, carry on from where you're at. It's just that I think it just means that people are not seeing the full slide, but they're seeing a smaller version of it. But it's okay. If you can't do it, don't worry.
Sorry.
Okay.
For me, it's clear.
What you could do is stop. Yeah, somebody's saying we can see it.
Stop share.
And try sharing again.
Okay. Share.
There we go. That's it. Perfect.
Better?
That's perfect. Yeah.
Sorry for the trouble and for the time lost.
Okay.
So you all know that bronchi are the tubes that lead the air we inspire from the mouth to the lungs. Bronchiectasis is a chronic respiratory disease of the airways after asthma and chronic obstructive pulmonary diseases, and is characterized by abnormal permanent dilatation of the bronchus, of the bronchi, as you see here, comparing to the normal lung. The main symptoms are cough, sputum production, and recurrent infections. How common it is? Till recently, it was thought that it is a neglected and rare disease, but the last decade, things have changed, and we all know now that it is more common than we thought before. What happens to the bronchial wall and bronchiectasis is developed? Here you can see a cross-section of a normal bronchus, and here a bronchiectatic bronchus with destruction in some areas of the bronchial wall, with wideness, with mucus full, with the lumen full of mucus, and loss of cilia in the inner place of the wall, that are small hair moving the mucus from the lumen from the lung to the mouth, be expectorated. Here you see other sections in another way, exactly the same things, a normal bronchus and the bronchiectatic one. 500 to 700 out of 100,000 people of the community develop bronchiectasis, and this seems to be increased. As age increases, the bronchiectasis rate is increased, and we know that in females is more common than in males. This is a German study, but the same things are shown in other studies of other countries. What happens? What are the causes that lead to the bronchiectasis development. There are too many categories of diseases, different, heterogeneous, that can lead to bronchiectasis. You see here a big list. Infectious diseases are the most important. Anatomic lesions may be present, like a foreign body inspiration, inflammatory diseases, genetic diseases, connective tissue diseases, pulmonary diseases like COPD and asthma, and so on. You see here also another category, which is characterized as idiopathic, and means that in this group of patients, no cause was found. In this pie, we see the results of EMBARC, the recent results of 17,000 patients analysis, and we see that exactly the same, 40% of the patients have no cause found for their bronchiectasis, and from the known causes, post-infective is the most common one, followed by COPD and asthma. Which are the most common symptoms of bronchiectasis that can lead us to suspect the disease? Chronic cough, chronic sputum production, and repeated chest infections, as you know, or exacerbation. But there are other additional symptoms present, not always, and not all of them, like dyspnea, wheezing, hemoptysis, fatigue, chest pain and weight loss, and many times symptoms from the upper airways like sinus problems. These symptoms are not special for bronchiectasis. They are similar to other airways diseases like asthma or chronic bronchitis or chronic obstructive pulmonary disease. And this is the reason why many times they explain the delay of the diagnosis of bronchiectasis. On the other side, you have to know that many times bronchiectasis coexists with asthma or COPD. So if you have these symptoms, it is sometimes that you can guide the clinician, the doctor, to think about bronchiectasis and to establish the diagnosis. How the diagnosis is confirmed? Very easily, performing a computed and high-resolution computed tomography. You see in these films the areas with bronchiectasis, very impressive. And you have also to know that it's not enough to have only symptoms or to prove only radiological signs that prove bronchiectasis. The definition must contain both clinical and radiological criteria so as to decide that we have a clinical significant bronchiectasis. This is a definition that an international group of experts has established and contains exactly special radiologic criteria as well as clinical criteria. So if you have confirmed the diagnosis, what steps are we going to do? We perform sputum culture to see if there are any microorganisms in order to treat them. We want then to see how the lung works using spirometry or other lung function tests. And we perform also blood tests for general health, but for looking for the underlying disease, because some of the causes of bronchiectasis are treatable. And this is very important to know. In this point, I'd like to show you that the sputum color is a tool that we can use to estimate if they are mucoid, mucopurulent or purulent. And here you see in real life the same a game of different sputum. And this is a simple tool to assess the inflammation and the response to treatment. It is something that you can notice, the change of sputum color, and you can inform your doctor in order to decide if it is an exacerbation you have to treat you with using additional treatment. What happens in the bronchi when bronchiectasis is developed? You see here a vicious circle, which is the basis of pathogenesis of bronchiectasis, containing 4 components that lead to the one to the other: bacterial infection, inflammation, sputum accumulation because of impaired mucociliary clearance, and destruction of the wall. Now we know that this has changed, and all these components are influenced and in a very complicated way. And here you see exactly the same thing. We speak now about the vicious vortex and not for a vicious circle. And this interaction of the components shows that it's not enough to treat one component and wait for the next, for example, exacerbation. If we treat an infection, we don't have to wait for the next exacerbation to treat, because the other components are working and the disease progresses. So it is necessary to use all the other treatment modalities and to treat inflammation, structural damage, and mucociliary clearance. This is very important to understand how pathogenesis works. Now, what is an exacerbation of bronchiectasis? It is an acute event of increase in symptoms in the course of the disease. It is very important to estimate exacerbation and treat them accordingly, because they have an adverse event on the course of the disease, and they are responsible for the increasing of the disease severity. We have also here a definition of bronchiectasis exacerbation, and we say that a person with bronchiectasis develop an exacerbation when it deteriorates 3 or more of the following key symptoms for at least 48 hours: cough, sputum volume, sputum, purulence, dyspnea, fatigue or malaise, hemoptysis, and it is necessary a clinician to determine that a change in bronchiectasis treatment is required. What are the causes of exacerbation? The main causative factor we know very well is infections. That's why you know instead of exacerbation, you use many times the term infection. But there are other potential causes, as you see here, that are not very well studied for the moment. It is very important to identify if there are microorganisms in the sputum of patients with bronchiectasis, and this will be done with performing sputum culture. EMBARC showed again that the most common pathogens in sputum of patients with bronchiectasis are Pseudomonas aeruginosa and Haemophilus influenza. And it is very important to have in mind that the population that have frequent exacerbations and Pseudomonas aeruginosa is the most severe one and had a very bad prognosis. You see here, the green line represents the group of patients with frequent exacerbations, more than 3, and Pseudomonas aeruginosa chronic infection, and you see how survival is worse. What about treatment? What are the goals of treatment? The goals are to reduce symptoms, to improve quality of life, to reduce exacerbations, to improve the function of the lung, to prevent hospital admission, and prevent mortality. And it is important to understand that although there are general rules of bronchiectasis management, treatment many times can be individualized according to the needs of each patient. What are the categories of the treatment we use for bronchiectasis? We have the European guidelines for managing bronchiectasis in adults, and these include too many topics. The most important thing we have to know is that the cornerstone of the pharmaceutical treatment are antibiotics. These can be given as short courses for an exacerbation, oral or intravenous. They can be given as anti-inflammatory drugs, usually macrolides for long-term use, or as inhaled antibiotics for eradicating the microorganisms, especially Pseudomonas aeruginosa. But there are too many other treatment modalities that include physiotherapy and airway clearance that are crucial for the treatment of bronchiectasis, mucolytic drugs, bronchodilators, inhaled steroids in some subgroups of patients, pulmonary rehabilitation that has been proved to be very effective, and we don't forget to treat the underlying cause as well as the coexisting diseases. And if we want to see which categories of treatment are referred to the different components of the vicious circle, we see, for example, here, for the inflammation, macrolides mainly, or inhaled corticosteroid for a subgroup of patients. For the infection, antibiotics, as we described before. For the tissue damage, bronchodilator at surgery in selected patients, and for clearing the mucus, physiotherapy as well, clearance, and so on. So, in summary, we can say that bronchiectasis is a common disease, and the diagnosis is very easy when suspected using a high RCT scan. It is necessary to investigate the cause of the underlying condition so as to treat it. As regarding the treatments, there are effective treatments that lead to the improvement of the symptoms and prevent the disease progress. And the treatment of infection, inflammation, eradication of pathogens, and airways clearance are critical in the management of the disease. It is important, additionally, that regular follow-up, education, and empowerment of the patients is required. There are some questions that I don't know if we shall let it for later, Michal or Maria. And with that, I'd like to thank you very much for your attention and to tell you that on July the 1st, we celebrate the World Bronchiectasis Day, to remind you. And our next World Bronchiectasis Conference is on July. And after that, maybe we have to tell you more things. Thank you very much.
Thank you very much, Katarina, for this lovely talk. And we'll have some Q&A session at the end of this session to answer some of the many questions that you may have. And with that, I would like to warmly welcome Dr. Fiona Musgrove. Dr. Musgrove is a general practitioner or family practitioner and a special interest in respiratory medicine. Fiona has been a family practitioner since 2012, and she works in a large practice in Aberdeen. Began to develop her special interest in 2018, studying for a postgraduate diploma and then a master's in respiratory medicine, with a project focused on the microbiology of bronchiectasis exacerbations. Dr. Musgrove will be talking about living with bronchiectasis, and we'll be sharing some practical tools to help with this.
Thanks very much, Michelle, for that introduction. I'm just going to try and share my screen. So hopefully, can you see that, Michelle?
Yes, we see in presenter mode. Can you reshare? Yes, this is perfect. Thank you.
You can see it. Perfect. That's wonderful. Thank you very much. And thanks so much for asking me to come and be part of this amazing patient conference. So my remit today is to talk a little bit about lifestyle, nutrition and mental health. And I think it's always important to be clear about why I'm able to talk to you about those things. So Michelle gave an outline of my career path. So I've been a GP for about 10 or 11 years now, and I spend a lot of my time talking to patients with various chronic health problems and helping them to manage those. I also manage some of my own health problems, and so a little bit of me is talking with a kind of patient hat on here. So I really wanted to start this by saying that we all have things that our lives spin around. So this picture is that our lives spin around different things. And for many of us, that might be a family or work or hobbies. But when you have a chronic condition, you have to spin your life around that a little bit. And that's not something that you've chosen, and that is often quite difficult. So what I'm hoping to do in this is to give you a very quick run through of some things that can be helpful in managing bronchiectasis day to day. So when I'm talking to patients, I like to describe a toolbox that you can dip into and pick different things from to help you manage things. And there are 4 big things in that toolbox. Okay. And those are sleep, eat, move, and relax. And this concept comes from a lovely book called the 4-Pillar Plan, which I would highly recommend to you. So I'm going to talk a little bit through each of those things, each of those tools, and the specific tips that I have within those bigger categories that I think are useful. So it's really important that we speak a little bit about physical health and mental health. So this is my representation of how I think we as a healthcare system deal with physical and mental health. So we tend to see them as quite separate things. They're dealt with by separate services often. And there maybe is a tiny bit where they can almost overlap, but we generally see them fairly separately. My experience, both as a patient and as a clinician, is that it's really all just about person health. Okay, and there's a huge overlap between physical health and mental health because they are just person health at the end of the day. So mental health problems can give physical symptoms, physical health problems can give symptoms related to the mind and thought patterns. So with that in mind, I'm going to start with what for me is the most important of the tools, which is sleep. So sleep is absolutely fascinating, and it's also utterly essential for us to function. It has a function in helping us to restore and repair, and sleep problems are a part of lots of different health problems, mental and physical. We know that if you don't sleep well, you may very well have an impact on your quality of life. You're likely to be tired, low in energy. And what we know is that if you don't sleep well and you don't sleep consistently well, amongst other things, you can't regulate your emotions properly. So you tend to become probably a bit more anxious or low, and it becomes a bit more difficult to navigate a clear path through life. A special note here in terms of bronchiectasis is that the impact of cough and sputum production we know is significant in many people with bronchiectasis. And we also know that something called obstructive sleep apnea is probably more common in patients with bronchiectasis. So my sleep tools are, number one, to identify and treat other health problems. So I mentioned obstructive sleep apnea. If you're somebody who suffers with sleepiness excessively during the day, if you have morning headaches, and if you have a partner that's identified that you snore significantly or stop breathing for periods during the night, then that's something to think about. Other more common things would be things like reflux disease and nose and sinus symptoms, but also mood problems. So if there are things like anxiety and depression, so if you feel like everything's just a worry or everything seems very negative, then it might be worth having a look into that. We're going to hear lots more about airway clearance, and I think airway clearance, particularly thinking about the timing of that around sleeping, is probably quite important. There are a long list of sleep hygiene tools that are really useful, and the link at the bottom of this slide will take you to a lovely list of those. But making sleep a priority and having a routine around it is very, very important. And there are some big things you can do to help with that. So keeping your caffeine in the first part of the day before 12 o'clock is quite important. Caffeine does hang around for some time in your system, and even having early afternoon coffees can impact your sleeping. Alcohol tends to reduce the time it takes you to fall asleep, but it will impact the quality of your sleep. And for many of us, it keeps prevents your heart rate from dropping sufficiently overnight, and that can lead to you waking feeling still quite tired. Time outdoors, particularly in the morning, helps to regulate your sleep-wake cycle, and that can really help with your sleeping. Having a routine around bedtime, so avoiding screens in the hour or so before bed, having a hot drink, a hot bath or a shower allows a temperature drop after that, which tends to promote sleep. And sleeping in absolute darkness is something that's really important. So good curtains or blinds or an eye mask if you can't manage that. So eating is the next of the tools. Diet's a really fascinating area. And I think it probably is to an extent that you are what you eat. There's lots of emerging evidence for the importance of gut bacteria and for fiber, because the bacteria in your gut feed on fiber. Processed foods, probably anything that you buy in a shop that has more than 5 ingredients would count as processed, is probably not that good for us. And there's some evidence emerging that it can lead to some inflammation within the gut and within the body. Probiotics, I've put a little mark against probiotics. So there's lots of data on probiotics, but it's quite a challenging area to give reliable advice because there are lots of different probiotics and they can be used and have been tried in lots of different situations. We know that if you are taking an acute course of antibiotics, they can be helpful in reducing side effects. But what's less clear, and what I certainly couldn't find any data on, was using probiotics in long-term antibiotic use, particularly for bronchiectasis. When we're giving antibiotics long-term, for many of them, they're not really working as antibiotics, so the role of probiotics there is less clear. Eating tools then are very straightforward. It's really important to keep well hydrated, and particularly so if you have bronchiectasis with lots of sputum production, because if you are dehydrated, there's a good chance that your sputum will be thicker. Fruit and vegetables are really important, particularly vegetables, because that gut bacteria feed on the fiber in vegetables. And if you're aiming for 3 to 5 different coloured vegetables in a day, that's a sensible aim. Whole grain carbohydrates, so looking at brown rice, brown pasta, brown bread, and some good quality protein, so dairy, fish, chicken, etc. As I previously discussed, avoiding highly processed and really sugary foods where you can, and accepting that everything is good in moderation, I think is a good plan as well. Vitamin D gets a special mention. So where you live in the world will impact your vitamin D in terms of how easy it is for you to access sunlight. So I'm up in the northeast of Scotland, and for a good portion of the year, I will be vitamin D deficient unless I take a vitamin D supplement. Vitamin D is really important for adequate immune function And we know that patients with bronchiectasis, particularly up in the part of the world where I am, are probably deficient. So it's worth having that checked and replacing it if you can. So on to my favorite of the tools, and this is Move. So this is a picture of a Saturday morning, probably not too long ago, at a castle very near where I live for park runs. So I'm a huge advocate of moving. We know that moving is something we're really designed to do as human beings, and there are lots of health benefits that have been shown from moving and exercising. There's a huge amount of evidence for pulmonary rehabilitation across lots of health outcomes. But we know also that if you have any respiratory condition that makes you breathless, breathlessness is linked in with anxiety. So breathlessness is a sign from our body to our brain that something is wrong and that we need to stop to protect ourselves. So if you have a condition that makes you breathless, pushing through that to allow yourself to keep moving is hugely challenging. And much of the experience of being a runner in the early days is getting used to the sensation of breathlessness and reassuring yourself that nothing bad is going to happen. So these are some really straightforward movement tools. So whatever movement you can do is better than no movement at all. And for some of that will be running. For some people, it will be walking to the end of the street and back. For some people, it will be sitting to standing from a chair. But whatever you can manage and doing it regularly and building from there is important. If you can find something that you enjoy, that makes it hugely easier to work it into your day-to-day routine. And combining exercise with airway clearance is always a good idea. So any exercise you do is likely to open up your airways and help you with getting rid of some mucus. There's lots of different types of movement. So aerobic exercise that you can do comfortably whilst you're talking, strength training with weights or with your own body weight to build muscle strength, and flexibility work like yoga and Pilates. So trying to have things across the spectrum is a good plan as well. And where you want to exercise is your own choice, and that's an individual risk benefit. So if you're worried about being inside due to the risk of viruses, then you might want to exercise outdoors, but that will probably depend on what the viral spread is like in your part of the world specifically, and what activity it is that you want to do. So relax is really an overlooked tool. So this photo is very near where I live, and as I've mentioned, I'm a runner, and running definitely helps me to relax. So we need to relax as humans. We need rest and we need stillness, and that's quite difficult in the world we live in today because it's all about being busy and doing things all of the time. But we need to drop our heart rate sometimes and just be still in order for our body and for our brains to recover. And it doesn't have to be sitting in a yoga pose. It can be doing group things with other people. It can be walking, it can be singing, but finding an activity that you enjoy that helps to make you feel a bit de-stressed and doing it with people that are like-minded is a good plan. Mindfulness is really worthwhile investment. It's not that easy always to do. It can be really challenging, and it's something that needs regular investment over time, but it can reap benefits at times of stress or pressure. So there's a common theme here. So accept that relaxation is important, I think, is the first thing. In a world where we're all doing everything all the time, you have to make space for relaxation. Find something that you find relaxing and do that thing regularly. Consider a few minutes of mindfulness or breath work regularly. It doesn't have to be much, but we know that if you invest a little bit of time in it, it can cause significant improvements in your anxiety and in your mood. And having fun is part of relaxing. So it doesn't have to be dull and boring. It can be and should be enjoyable. So I wanted just to finish this with a very brief note on mental health. So in the excellent book at the bottom of the slide, which is called Manage Your Mind, anxiety and depression are described as the twin enemies of good mood, and they're woven into the experience of many conditions and also of bronchiectasis. The tools that I've described are always really helpful for mental health, for anxiety and depression, but I think it's also going back to that piece about having to spin your life around something something that you did not choose, and that is not something that everyone has to deal with, and it's not something that you will always find easy to accept. So acceptance of your health condition or any problem in life is not an absolute. Fluctuation is normal, and it's okay to be frustrated, angry, sad, resentful, and it's even more okay to talk about it, which is why I think that finding your support group is really important. So acceptance isn't a constant, ongoing process. Use these big 4 tools to help where you can, and acknowledging that they might be important and giving some to reap benefits. If you can find some enjoyment in using these tools and in identifying your support group, then I think so much the better. And I'm going to leave you just with this, one of my favourite quotes from Sylvia Plath, which I think speaks a little bit towards mindfulness. Thank you very much.
Thank you very much, Fiona. These were really nice tips and really good to have. And I see some many questions in the chat, both for Katarina and for Fiona. Maybe I can start with a question for Katarina. And one of the questions was, how do we define mild, moderate, and severe disease? Can you please unmute? Thanks, great.
There are there is a way to grade the severity of the disease, and this is a score that has been developed by James Chalmers actually, and BSI, and another score that includes too many parameters in order to define if the disease is mild, moderate, or severe. These are the age, the severity of lung function impairment, the presence of pseudomonas, the extension of the bronchiectasis on CT scan, the number of exacerbations, the degree of dyspnea. I think these are the main parameters, and according to that, there is a grade to decide if the disease is mild, moderate, or severe. But in clinical practice, as I see another similar question, there are cases that, for example, the radiological findings are very extensive, but the disease is mild. The clinical presentation is mild. This, or the opposite. This may happen because, as I said you before, there are too many parameters that have to be combined in order to decide the severity of the disease and to treat accordingly.
So I've written down some questions from the chat, and this one I think, Fiona, probably you can start, and then maybe Katarina can continue. Regarding pain in bronchiectasis, and especially in exacerbations. So the people want to know, is it common, and what to do with pain?
That's a great question.
I think it was chest pain.
Yeah, so it can happen, and we definitely do see it in other respiratory diseases as well. So I think, I mean, I guess from my perspective, managing pain is often quite complex, and an element of it is to do with fear, usually around, you know, why am I sore? And pain is a bit like breathlessness in that it's a sign from our body that something might be wrong, that we need to do something about it. So I think probably a good understanding of why the pain is there, and a good discussion with your clinician about, if you're somebody who gets pain when you have an exacerbation, what tools you can use. And that might be medication, it might be practical tools that you can do yourself, that will be helpful for that. I'd be interested to hear Katarina's thoughts on that as well.
Yes, I agree. I'd like to add that the bronchi and the lung don't produce pain. So most of the times it's because of the cough, and the pain is produced from the bronchial wall, or it is a tightness, as Fiora said before. I don't think there are special treatments except of anti-inflammatories. Anyway, it's not one of the main symptoms of bronchiectasis.
Yeah, we've been all taught in medical school that the lungs don't hurt, but our patients teach us differently. Pain is very common in exacerbations. So Maria, would you like to take some questions from the chat?
Yes, of course. So I have a question here, which I think is directed at Fiona, but maybe you can both help, which is to do with vitamin D levels. So this is the sort of thing that sometimes can be a bit empirical, or so someone is asking very directly, which I don't think there is an answer. What are the target levels for vitamin D in bronchiectasis patients? But of course, I understand you probably can't answer this. So can you explore a bit more on the role of vitamin D and who should really take vitamin D and how much, and whether this is something that should be guided by a clinician or not?
Yeah, so vitamin D is something that's often talked about, certainly where I work, because we're probably all deficient in vitamin D unless we're taking a supplement, because we don't get enough sun for enough of the year, sadly. Levels, that feels like an exam question. I can't remember off the top of my head, because when I interpret results, I always have a reference range there. But if I think about most of my patient group broadly that I check in, it's very unusual for patients to be sufficient. They usually have, so there's adequate, or deficient or sufficient. So it will be affected by which latitude you're at and how much sunlight you get, and probably to an extent by diet. But if you're somebody who has bronchiectasis, particularly if you don't get a lot of time outside, and particularly if you live somewhere like I do, where it's often a bit grey and cloudy, it's certainly worth having it checked. I suspect we don't have data that link vitamin D with specific outcomes in terms of frequency exacerbation, for example, but we do have evidence that vitamin D is really important at a level of the cell for your immune function.
Okay,
yes,
thank you very much.
There are studies, I agree, there are studies that show that there is a vitamin D deficiency in a subgroup of bronchiectasis patients. But I don't know if we have at the moment in which way we can add them, which is the dose, it's not a recommendation for the moment.
Okay, thank you very much. I think that now we need to move on, unfortunately, because we are a bit delayed because of all the problems in the beginning. So I hand over, we will now start on session 2 on airway clearance, and I hand over to Barbara. Thank you.